Why is it that diabetic patients are losing their vision in spite of latest advances in technology? The reason is because there are some cases which require surgery immediately, and they do not do well with simple laser treatment. Everybody believes that laser treatment is one of the basic treatments for diabetic retinopathy, especially when you've come into the advanced stage called proliferative diabetic retinopathy. Laser treatment is a must. But many doctors don't understand the need to operate. When do you operate? You operate when the jelly inside the eye or the vitreous begins to separate from the retina in such cases. The reason is because it is very adherent to the retina. It tends to form membranes on the retina and pull up the retina in something called a fractional retinal detachment. We must operate before that stage comes in order to save vision. Definitely, it is risky in diabetic patients because the risk of bleeding is very high, but your risk is much less than the benefit you could get by doing an early vitrectomy surgery. Surgery, when done early, can prevent vision loss in diabetic patients. It is extremely important to understand that surgery can be a sight-saving procedure. Patients run away from surgery. Patients think, if I can do without surgery, that is the best thing for me. If you have two doctors, one advises surgery and the other says there is no need for surgery. The other says, let us just wait and watch, you will be all right with time. The patient tends to listen to the doctor who says there is no need for surgery. It is normal human psychology. But let me tell you, in retina, it is not like that. There is a time when you operate and you actually save vision. Do not hesitate to undergo surgery. There is a reason why your doctor has advised surgery. In fact, there are cases of vitreous hemorrhage, which is bleeding inside the eye. There are some cases which just respond to injections, and there are other cases which resolve with time. And the patient wonders, why has my doctor advised surgery when I have actually become all right without surgery? Now, what has happened in your case is the bleeding has just settled down. That does not mean your problem is completely gone. A vitrectomized eye, or an eye which has undergone surgery, is safe in the long run. Just because your bleed has come down at this time, it does not mean your eye is safe in future. The earlier you do a surgery, the safer it is for your retina in future as well. As long as you have had a vitreous hemorrhage or bleeding inside the eye, it has settled with an injection, that's fine. What we are doing is just delaying your surgery. But do remember, surgery may be one of the critical procedures which can save vision in a diabetic patient. I've had so many patients come to me after that last stage has gone by. They come saying all doctors have given up hope. That is because they have not been operated or even advised operation at that right time. It is important to watch the retina, watch the vitreous phase. If the jelly is beginning to lift off the retina, if it's beginning to separate and it's causing a pull on the retina, get in there with your instruments and cut that. Settle the retina. In these cases, silicone oil also may not be required in most of the cases. It's a simple vitrectomy surgery. The damage caused by this vitreous is unbelievable in diabetic patients. In fact, the earlier you remove this vitreous, all other problems are taken care of, including macular edema. Macular edema also comes again and again in diabetic patients because of this vitreous. All the problems in diabetics mainly happen because of this vitreous. Now, I'm not saying surgery has no risk. Definitely, there are risks involved. It's important for the surgeon to take care of all the possible things that are required during the surgery to ensure that those risks are minimized. Do it with the latest equipment. Do it with a 23-25 gauge instrument. And make sure that there are no breaks on the retina when you are operating. This is one of the things. Another thing is the importance of injections. Now, there are injections available called anti-VEGF injections. These anti-VEGF injections help to shrink the new vessels on the retina. Now, sometimes you feel just giving the injection is not helping me. My vision has not improved after your injection has been given. The injection was not meant to improve your vision. The injection was meant to shrink the new vessels, which are responsible for your late stage of diabetic retinopathy. This may be required on multiple occasions. There are patients who need monthly injections even until the surgery is done. So if you are diabetic, even if your sugar has been well under control for a long time, even if you feel everything is going great and your vision is absolutely normal, I urge you to go to a retina specialist, get a complete retina examination done. If you have been an uncontrolled diabetic, you need to go every 6 months to the retina specialist. If you've already been diagnosed with early diabetic retinopathy, you need to go even sooner. Don't assume that treatment is a once-in-a-lifetime thing, because diabetes is going to be there with you forever, till your last day. So check up your retina, save your vision, and also ensure to check your kidneys at the same time.